You don't love my feet? Stop. So this is the differences between training a pro athlete and a recreational athlete. And this is just coming from me, who's worked with some people that have competed at a national, international level down to your average Joe. So if you want to take away how you want to plan your program, if you're training someone, or if you're training yourself, or you want to set yourself beyond the recreational athlete, maybe there'll be a few points in this video for you to take home today. So just as a disclaimer, I'm using the term pro quite loosely. My definition of pro doesn't necessarily mean paid to play. Rather, I've trained with people who have competed for Commonwealth or for Paralympians or in national, international competitions, and I've just taken a few things from my interactions with them. Starting from number one, pro players will always do what they've said. They will not say no, and they will put in the reps. So their intrinsic motivation is high. So if you say jump, they say how high, and then they just go. You're just like, whoa, it's like hamster on a little training wheel. It's pretty cool. Didn't mean to demean them like that. Exercise prescription, sets, reps, they will do it. Whatever it is, they will do it. And even if you compare these pro athletes to that of a recreational athlete, the compliance is higher, much like how recreational athletes have a 40% higher compliance than that of your sedentary type patient, the person who pulls his back after picking up a tissue off the ground. Point number two, the opposite is also true. So just as their intrinsic motivation is high, you have to match that with good extrinsic motivation. So you need to put in the work to know how to motivate them. You make the expectations and then they perform. Therefore, you also need to sort of put in your reps. They have the time, they have the willingness. You tell them to do 50 and then they do 50. You know Drake's song? Drop and give them 50. You say do 20 lots of 50 and they will do 20 lots of 50. There's no, I don't want to, I don't know, maybe. And what is the drawback? The drawback is if you give them something that is too hard, then obviously overtraining is going to be an issue. Too much of something can cause overtraining and then you get your repetitive stress injury or you get a tendinosis. Alternately, if you're getting them to drill 20 lots of 50 in terms of external rotations, just winding the band outwards, then you're probably underutilizing your time. Everything has to be planned and you have to justify why you're doing a certain type of exercise. Point 2.5, and it's not just the exercise sets and reps that you're giving to them, but the way you're communicating that exercise to them, that has to be prompt, perfect. You can't wing it, you can't give half instructions and just call it good enough. Like it has to be perfect. The execution has to be perfect. For example, let's say someone's doing a leg press or someone's doing sleds and they're quad dominant. They always feel it in their quads. Quads. Strap an EMG to their quads and it's beeping off on quads. But how are you gonna prompt them to use their hamstrings now? You know, what does it mean when they're doing the incline leg press and their foot is on the plate? What are you gonna do with the toe out? How much toe out in order to drive hamstrings, right? You can always put an EMG and just figure it out, investigate, problem solve, troubleshoot. You know, how much knee varus, which is tilting your knees outwards to the side, or how much knee valgus do you want, tilting your knees inwards, buckling your knees inwards, do you want them to have? And then what about the hips, pelvis, nutation, counter nutation? What about their back? You know, how much lordosis, how much kyphosis do you want in their back? Is it pressed against the back of the leg press in order to work their hamstrings? Or how far up the plate with kyphosis do you want them to be in to work their hamstrings? If you, the clinician, know how to change from quads to hamstrings in a leg press, and then change them back to hamstrings to quads to work both muscle groups, that's what you need to do. Give them prompts, know how to do it, demonstrate it, change them back to quads, and then we're good to go. Literally break down the exercise. And you can go one step further, point 2.7. I guess. Are you using leg press for isometrics? Are you using leg press for strength? Or are you doing it for, you know, sheer speed, which is going to be more quad focused? You know, different ways to modify your exercise. Point number 3, now you gotta know the sport. So if we're talking about jumping higher, dabble into the force velocity profile. Figure out whether your athlete is force deficient or velocity deficient, and then work a program to pick on those areas of interest. And I kid you not, it's gonna go up by 5 to 12%. So divvy up your exercise and modify them, or pick out the exercises that focus on either force, maximum loading, strength, isometrics, pause and how long of a pause, long eccentrics and how long of a long eccentric, and then elasticity, which is basically your plyometrics. And if we're talking about basketball and you're training a spot shooter, right, you need to feel what it feels like the specific burn of shooting 100 to maybe 250 shots. And then you get to figure out whether for you or your player is full range of motion triceps going to be more suitable for your training, or is partial range of motion triceps going to be more time efficient for you and still reap the same benefits. And finally, for a third example, if you're training someone to run a marathon, why are they getting VMO sartorius pain, which is that muscle that goes from the hips to the inside of your knee, that teardrop shaped muscle that soccer players have? Why is that starting to burn around the 15 to 30 kilometer mark? That's a huge window that when they step, how flat-footed are they, right? Flat-footed into ankle pronation, into knees caving inwards, into weak gluteal stabilizers. Work on the gluteal stabilizers and then see how that modifies your VMO strain. Number 4 is break down the sport, break down the injury, and then switch it up within the sport. Hang on. It sounds complicated, but I swear, it'll make sense. So you have an athlete that keeps on getting a calf strain as a midfoot striker. And every 3 weeks, he comes back with a gastroc strain, hurts his calf, and he sets himself 3 steps back, okay? Ask yourself why. Why are they continuously getting a calf strain? Does it always happen when they go from eccentric to concentric phase calves? What pace are they running at? How far along the track are they running it? What's the terrain? And in assumption that they've rested well, what happens if you deliberately tell them to jog at a 10 to 13 minute pace, deliberately with the forefoot strike? With forefoot striking, there's going to be more eccentric loading of your calves as you enter in dorsiflexion as opposed to midfoot striking. And then you have to work and control your landing force at the same time, contract with more ballistic forces, but you're running at a slower pace, which is going to be arguably easier for a midfoot striker that has this recurring problem. And then have a graded approach to increase pace and then to draw back into a midfoot striking position, and then see what happens when you start to build up distance. And then what about for basketball? Let's say we're dealing with the same calf strain. Frame it like this. You always get a calf strain when you go into forceful plantar flexion and you're already at end of dorsiflexion range. Get where I'm going? So because you're in dorsiflexion, eccentric calves, drop step backwards, boom, sudden acceleration or change in directions from static, that's where your calf goes, or even worse, your Achilles goes. RIP Tyrese, did you see it? Did you see it? No. But on the board, drop step, goes into dorsiflexion, extreme plantar flexion, boom, and then, his Achilles. I was going for OKC anyway, but it sucks because Tyrese Halliburton went through an Achilles tear. Watershed zones, go suss that out. Maybe I'll do another video on Achilles tear and calf tear, but it's the same MOI. To be honest, if you had watched this video, I don't think it would have changed the outcome. And then down goes the credibility of this video. Tyrese, I'll treat you for free. Come over. Educate them that the most common fiber to go in this situation is, again, your type 2 fibers, because they're your explosive fibers as opposed to the endurance fibers. And then after that, figure out what exercise you need to do and then add on external perturbations. External perturbations are basically when you have external forces pushing you off balance. So those type 2 fibers need to work extra hard to control balancing forces at the same time, explode off. Point number 5. Now you gotta start thinking outside the sport. So we went from into the sport, super deep into the sport, into outside the sport. So draw inspiration from other sports. For example, basketball and ACL tears. ACL tears is a whole different conversation, but TLDR, ACL tears occur when you have 15 to 30 degrees knee flexion and then you pivot shift, which is the crazy external rotation or crazy internal rotation. Draw inspiration from ice skaters that land on external perturbation, so landing on a wedge. So you can land on a wedge that tilts you, that tilts you into ankle inversion. And then you have to stabilize with your knees, you have to compensate with your hips, and that's a good external perturbation. Landing onto different terrains, landing onto different heights, landing and pausing. Make use of all forms of external perturbations and then build on that neuromuscular firing so that you can foolproof your landing, foolproof, prevent pivot shifts, prevent ACL tears. Number 6 is when you start training at high levels, you need to do some sort of periodization. And you also need to factor in rest. So figure out which periodization works best for you. There's linear, which is increasing weight and decreasing rep over time. Then there's undulating, which is basically having split days. So one hypertrophy, high rep, high volume day, and then one strength day, which is, high intensity, low rep. Then you can have conjugate. Conjugate periodization looks at the force velocity profile, and then it mixes speed, strength, and repetition. And then finally, periodization is more like the block periodization is basically working on each separate thing in maybe 1 to 2 week blocks, 1 week usually, and then putting them all together at the end. So you can work on, going back to the force velocity profile, you can work on either of the strength, pause, isometric, speed, whatever, and then putting them all together at the end. Point number 7, the training and the program, they're both co-owned. You own 50%, they own 50%. If you guys are not on the same page, your training's wasted. So you best try and justify, negotiate, and reason why they need to train in this way to increase their deadlift or increase their squat or whatever. But they also have to find value in, I want to increase my squats so I can play better basketball. I don't know. They need to weave it into a way where they feel justified. You need to weave it a way that supports them in justifying what they're doing. Figure out if that makes sense, Josh. Rather be on the same page, investigate, problem solve, and then the training is going to be better received. Number 8 is your job doesn't stop at being a physio. So they're injured. As a physio, bring them back up to baseline. Point number 9 is your job doesn't stop at being a coach. So after you get to baseline, bring them through to crushing their PB. So as a physio, you can give cookie cutter approaches to getting them to baseline. And then as a coach, no more cookie cutter programs. You can't give them like a blanket statement solution to training unless they're a beginner. You have to give them solutions to their specific problem. To get from baseline to where you want to go, to squatting 180 Ks, to benching 150 Ks, that's all individualized. You can't use a cookie cutter approach to see which part of your squat training is going to benefit your basketball training or your ice skating training or whatever. That's all individualized, that's all tailored. You gotta figure that out on yourself. The best example that depicts tip number 9 is how do you continue to make an athlete better despite their 5-inch leg length discrepancy? That becomes hyper-specific. Finally, the last point that I want to enforce is you just gotta support your player. You gotta support yourself if you are the player. Ask yourself, how do you support them? Communicate, talk about stuff. Give them room to talk. Talk about memes, talk about off-sport stuff. Talk beyond the realms of sport. And then you have bandwidth to focus on the sport. Know your player specifically. Do they have any cultures and habits before going into training? What is your own culture and habit and routine before you go into a PR squat or a PR bench or a PR deadlift? Figure that out. Figure out your most comfortable training intensities, and then once a week or every 2 weeks or 3 weeks or within the week, how many times do you push beyond your comfort levels? Figure out your favorite exercises, figure out your most hated exercises, and then titrate them. So you can have 90% favorite exercises, 10% hated exercises. Over 3 weeks, go to 50-50. Over 6 weeks, go to 90% hated exercises and 10% favorite exercises. Because you're pushing your discomfort zones, you're gonna reap better rewards. And then you can also figure out how hard can they push themselves. Do they tend to overthink things and not push themselves? Figure out their rate of perceived exertion, get them to write a diary. How did you feel doing this exercise? How did you feel after this program? Blah, 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 blah. Watch that kind of undulate. How did they feel when they squatted 160, 180 kilograms that day? Were they feeling good? Were they feeling bad? Were they feeling mid? What do they look like when they're stagnating? Over how many weeks? What do the metrics say? Are you recording the metrics? Rehashing all the points, You as the trainer or you as a person, you are the consultant. If they have an issue in their rehab, you have to figure out why. Figure out, literally go into the micros. You're the answers man. But the answer man only works if you're explaining the exercise with the right prompts, describing it in the right way. You gotta make sure that they can do it frame by frame perfectly by themselves, and then they actually gotta do it. No moping, no whinging, no being a little bee. And then after doing it, a few thousand times, 10,000 times, then producing it in competition. Then when you put in all the variables, the random variables, external perturbations or whatever in game time, you're not gonna stuff up because you've done it so many times. But the other thing is, the thing that I really want to leave on is all of this takes time. All of this takes failure, and failure isn't failure. If you attempt 80 squat, 60 kilogram person, 180, and you failed, that's not a fail. That's you gave it a go. Break it down, study it, modify it, see what things you need to work on. And within 6 months to 2 years, you're gonna push past that. Just trust in the process. All right, like and subscribe. I'll see you in the next video. Getting out of that position really hurts. I'm unk, man. I'm actually getting unk.